Why don't you use the term non-STEMI, Professor?
I do use it, but not for just any case where there is a raised troponin.
If the troponin is raised, doesn't that mean there has been myocardial infarction?
Not at all. Many conditions may lead to a raised troponin.
Such as?
Well, tachycardias, such as sustained atrial fibrillation or SVT, pulmonary embolism, septicemia and other forms of shock, pneumonia, pericarditis, etc.
But doesn't a raised troponin mean cell death, that is, infarction?
Cell damage, not necessarily necrosis. Only very high troponin levels are likely to mean myocardial infarction.
How high?
It depends on the assay. As a guide, I'd say, for troponin I, levels over 20. For troponin T, levels in the hundreds.
So when should we use the term non-STEMI?
When you wish to communicate non-urgent coronary occlusion.
That's in contrast to ST elevation MI, when time to open the artery is of the essence.
That's right.
I see. Is non-STEMI always a manifestation of acute coronary syndrome? By which I mean plaque rupture.
No. You're close. ST elevation MI is almost always due to plaque rupture with complete coronary occlusion.
That's when we go to the cath lab or use thrombolysis.
Sometimes non-STEMI is also due to plaque rupture, but only subtotal occlusion. And even total occlusion if collateral blood flow has developed adequately.
Is this how people with chronic occlusion stay alive?
Yes.
Many patients with stable coronary disease form collaterals and can maintain enough blood flow to areas downstream at rest.
Is this when non-STEMI can be due to increased cardiac work? Or a fall in coronary perfusion pressure?
Yes. Both can lead to severe supply/demand imbalance and cell injury or death.
Tell me more about that, but not today. So some patients have ischemia but not necessarily plaque rupture with thrombosis. Does that mean antithrombotic treatment is not likely to help?
Exactly. But you don't know in advance if that's the case, so the pathways say to give this treatment to all patients initially.
More important, however, is treatment to reduce myocardial oxygen demand.
Tomorrow, please. I think my brain is going to explode.
Yes. Tomorrow.